Hi everyone, I'm Ian from OxyHealthCare and I'm here today to do a quick Q&A on hyperbaric oxygen therapy because we seem to be getting a lot of similar questions online, so I thought we'd do a Q&A to try and answer the most commonly asked questions. Question 1. What actually is HBOT and how does it work? Well, in simple terms, you're sitting in a pressurized chamber breathing in high concentration oxygen, around 93 to 95%. Normally oxygen travels on your red blood cells, but with pressure we can push it deeper, beyond the red blood cell carrying capacity and directly into the blood plasma. Now this means that your body is getting way more oxygen than what it would from ambient air. More oxygen means faster healing, less inflammation and more energy. And essentially we're supercharging your body's ability to repair and recover. Question 2. What conditions does HBOT help with? Well, this is what is truly fascinating about HBOT. It has such a simple mechanism of action, oxygen under pressure, but such a broad use case. And we work with patients dealing with chronic fatigue syndrome, ME, sports injury, pre and post-surgery recovery, cancer support and autoimmune disorders. And we like to think of it as giving your body the fuel it needs to repair, recover and renew. Question 3. Is it safe? Are there any side effects? HBOT is very safe. The most common thing that people notice is a bit of ear popping, similar to when you're in an aeroplane. Now this is called barotrauma, and it's simply a pressure difference between the inner and the outer ear. It rarely happens, it causes no long-lasting damage, and we show you how to clear your ears easily if this occurs. Some people can feel tired and fatigued afterwards, but that's your body getting ready to repair and recover, and we see it as a healing response. And for those of you with claustrophobia, I would say please be assured we stay with you the entire time to ensure that you're comfortable and, more importantly, safe. Question 4. How many sessions will I need? Well, that truly depends on what you're looking to manage, and each session is typically 60 to 90 minutes. For chronic or complex conditions, we often recommend longer protocols of 10, 20, or sometimes 40 sessions to give your body consistent exposure to high concentration oxygen. But we always say start with a minimum of 5 so you get a real tangible benefit from your experience here. Question 5. How much does it cost? Well, we try to keep it flexible. Taster sessions start at £30 in our soft shell chamber and they're £50 in our medical grade hard shell chamber. A standard 1 hour session in the soft shell is £80, and we offer discounted packages on 5, 10, 20 and 40 sessions. So of course there's a financial commitment, but there's also a time commitment as well. And very similar to something like physiotherapy, one session isn't going to fix everything. And unfortunately at the moment, private health cover doesn't cover you for hyperbarics. But in terms of investing in your own health, it's one of the best investments you can make. So those are the 5 most common questions we see online. And HBOT, in a nutshell, oxygen under pressure, helping your body do what it does best, heal and recover. If you've got more questions, please drop them in the comments below. Visit our website, oxyhealthcare.co.uk, and why don't you book a taster session, come and experience it for yourself, and see what hyperbarics can truly offer you.